Thanks for joining and thanks for the session today. So, for all the members, very good morning. This is Saurabh Singh, your host, and welcome Neelam Verma, who is part of TOSUD, who is taking the session for today. So, our topic today is on digital health in and cybersecurity events for particularly healthcare domain. And I'm reading out the rules for the session today. You will be granted one CPE for the full session. To be precise, 50 minutes if you will join, one CPE will be granted. And other rules are common and the old one. You can give feedback. You have the ID, email ID, and phone number where you can connect for any queries, suggestions, and feedbacks. You can use Q&A box for Q&As, and we will address those because this is a quick session of 1 hour. We will see and make it interactive. We'll try to make it interactive with the Q&As. So I'm covering Neelam Verma, who is part of TUSUD, and she is working as a research analyst, consultant in a risk domain. And she has a lot of accolades, particularly research in the vulnerabilities aspect as well. And she's part of automotive and IoT domain and healthcare business unit, particularly. Neelam, I'm handing over to you. You can introduce yourself and you can share your screen. I'll make it off.
Sure. Thank you.
Yeah.
Okay. Thank you, sir, for quick introduction. So, very good morning to all of you. Welcome to ISACA New Delhi chapter. And today we are covering digital healthcare and cybersecurity. And today we are going to reflect the concern about the digital healthcare. So, moving ahead, uh, the agenda of the topic is we are focusing more on the perspective of digital healthcare future. So, we are covering for smartwatch as a future and how the smart hospitals, patient facilities are going to be integrated in terms of healthcare, how AI is getting more involved and reflected towards the healthcare. Okay.
Right, Neelam, and I believe this is very relevant and pertinent topic for today's world. Healthcare is essential for everyone and is evolving with the new age cutting edge technologies like AI and innovation in the healthcare facilities as well. So, as I am aware that we have discussed that you are going to cover the threats, innovations, and facilities, how the field is evolving, and we are part of it as we are using the gadgets and we are trying to be more healthy with the newest technologies as well as we are availing the services whenever we are, get ill or say, can we use those facilities? How should we beware about and what are our rights, particularly in the healthcare domain? So we will cover those. Thanks for we are speaker today.
Thank you, sir. Okay, so quick introduction about myself. I'm Neelam Verma. I'm senior cybersecurity engineer at Truthsuit South Asia. So before jumping into the healthcare sector, I was working with an automotive company for around 1.5 years. Also, I have done my master's specific in cybersecurity. You can follow me on Twitter, and you can even read some Medium blogs on the vulnerabilities, identifications, and everything. And of course, you can follow me on the LinkedIn. Okay, so let's get started. So, just taking in some consideration how the smartwatch and the healthcare data is being integrated, or when it is being touched to a human body. So what do you check before you want to buy any fitness watch or any fitness tracker? So the more key point, or you can say the more key aspects you look after, you of course look after the functionality. What are the specifications? What is the latest thing which has been involved in it, and what technology they are using? How long the customer support is going to take care of you in terms of damage, or in terms of some misconfigurations. So what you review, also of course the reviews from the previous customers based on the demands. So keep noted, I am not targeting any specific brand on making concern of any smartwatches. I'm just talking about, we are just focusing on the technology, and we are just focusing on the technology which is getting involved in human healthcare. Also the how you know, transparent online communications to the companies, how the services are going to be, is it going to be smooth, or what are the obstacle we are going to face it on. But what are the battery capacities, some regulations, some approvals like FDA or CE mark, like if it has been US FDA recognition, or being a certified authority or not. Right? So these are the things which we take care before buying any smartwatches. But we will of course see what we don't look after.
Yeah,
So
rightly said that we are not promoting any brand or giving reviews to any brand related to technologies, but we are discussing about the concerns and approvals and safety guidelines we should follow. Rightly said. If you can present in the full PPT mode, that will be helpful.
it's not in full PPT mode.
No, not now.
Because I have kept in.
Are you using dual screen?
Let me reshare it.
Yeah.
Okay now.
Yeah, it's perfect. Yeah.
Okay. Thank you. Okay. So the next is, um, have you made a right decision, or like how things you have used as a smartwatch, like do take a consideration of during the quarantine or during the COVID, how we have utilized these watches. So I believe that many people were focusing more towards the health, eating a lot of healthy food, doing a lot of exercise, sitting at home, because of course we cannot go outside and do some other activities, some online yogas and online marathons between you can say the virtual marathons between different kind of people who are having treadmill at home. And this is how we use, or how we try to use in past 2 years or 2.5 years, um, making advantage or use of these smartwatches. Okay. So before buying any smartwatch, so do you do your do you really do your homework before compromising on specific to your health data? So smartwatch typically focuses more on the smart sleep tracking, or you can say on the your ECG level, your blood pressure, or your smart fitness tracker. So taking an example of smart sleep tracker, which have gained popularity on the ability to enhance sleep quality and overall health. So These devices use advanced sensors or monitors with various aspects of your sleep, such as the durations or some interruptions on your sleep catches. So, by collecting all of your sleep patterns or by organizing the sleep patterns a human is facing, they offer insights or into your sleep quality, enable you to make necessary adjustment for more restful or have a very good sleep. Or additionally, you can say some sleep tracking or sleep trackers can also sync with your alarm clock, so which can gently wake you up with the optimal point, or if you, or maybe in your sleep cycle to help free or more refreshing or some sort of alert in the morning. So what do you think how these alerts are being generated? Do you really think that you set it by your own, or how the device is getting to know that at, you just want 6 hours or maybe 8 hours, or even if you're waking in middle, so why it's not generating alarm in you for you in between? So these are various questions which comes in mind when we say that we are using some smart watches or some smart gadget to help us to reduce our daily task. Also, in terms of the ECG watches, so ECG is nothing but electrocardiogram with watches which have brought the like clinically grade for heart monitoring on your wrist for any consumers. So these watches feature built in the ECG sensors that measures the electrical activities of your heart. So use so users can track their heart rate, they can detect irregular rhythms, and even record you can say ECG readings. So also you can say that which can be invaluable for identifying a potential heart condition. So maybe when you must have faced sometimes, or maybe not most of the times, that the device or the smartwatch which is giving you the rate, and if you will go back to the hospital, or some tools if you can purchase from the pharmaceuticals brand, and if you can try to track there will be some slight differentiations. It may be possible some medium differentiations as well. So
Neelam,
these,
very interesting point you have raised. Actually,
uh,
I myself as a user never actually believe that they are giving accurate rating with respect to ECG and other features. So, is there
yes.
any quality metrics or any kind of research which is available to all of users who can refer, and those can be used as a medical situation? Means, can we rely on those actually?
No. No, no. So maybe the coming slides are going to be more interesting, but these, like again, I'm not targeting any specific brand, but these watches are not at all reliable. I personally never use these smart watches. More often, if you are really concerned or if you're facing some health issues, you must consider or refer to good hospitals, or follow the doctor's prescriptions, other than relying something which is available at your home, or
Yeah.
giving you guidance or some data depending upon your body patterns, that what you're eating, how much water you're consuming, and how much sleep you are taking in.
Another aspect that uh, these companies are collecting our data and keeping our data. So
Mm.
can we check that there is a retention period, or there's a consent they look for from us particularly, and should we do we have a right actually to ask them in India, for maybe in other geographies also, and if you're aware you can cover, like do we have a right on these companies to ask that, okay, what is the data you have captured, what is the retention, if you have deleted it now because I'm not using your watch anymore, kind of.
So, if you will go through their terms and conditions or privacy policy, they have specifically written that whatever data we are using it or whatever data we are collecting from every consumer, they even have a right that if needed they can sell it, or they may can use not specifically they have written they can sell it, but in different terms they can use it for future consideration or for future results, because we want our consumers to have a good experience. So we are not sure that if your data is really safe, or whatever uh, whatever patterns every day every human is generating on these smartwatches are going to be reliable on these companies. And the other aspect of collecting such data can be they are keeping track of you, that what is your daily activities and what you're doing. Based on that, to other fitness applications, they are selling it to them, and they can guide you according to their own prescription that you should follow this diet, and you should look after this you can say this, yeah, how can I say that, this feature that we are offering you for this
Yeah.
much cost of amount. And we never get to know how they are getting such kind of things.
So
We
initially, consent they are taking and they are using the data and they are selling to other companies. They're using
Yeah,
at their will. Okay, fine. Can we move to other topic and that's the flow of yours? Thanks for
yeah,
answering. Yeah.
sure. Okay, so
Can you change?
the yeah, I'm not finished yet, maybe.
Okay. Yeah.
Yeah. So smart fitness tracker have evolved beyond the basic step counting. So now that they are now compromised or insights into physical activities, including the GPS tracking or even blood oxygen level measures. So these devices encourage user to stay active by setting personalized goal or tracking the progress, also by providing some real-time feedback on their workout, with integrating with the smartphone apps which allow user to analyze the data over time. Also, which the most interesting things it also make informed discussions about their fitness routine, and share their achievements with the friends or even the online communities, fostering some motivations or the accountability on this. So what like we have been studying the human body map from our childhood, that what exactly the human body map looks like. So this is just a normal gesture of the human body, that we have arms, then we have a brain, we have eyes, and so on and so forth. But if we will see that how the body is being mapped with the digital health system, so you can say that not even a single part of your body has been left which is not connected to any gadget or any smartphone or any smart device. So taking it from your head to toe, every activity which we do and whatever we have discussed about, everything is being monitored and being considered. So moving ahead, um, so what do you think that just the discussions which we had, how dangerous these ECG watches can be or the smart watches can be? So have you have any thoughts about it, or if you have any situations which you have faced or heard from someone?
We have views from the Isaka chapter members that some smartwatches are really good and they are providing accurate and good ratings. Those can be used as for medical
Mm.
situation. Yeah.
Yeah. So, there was a research or you can say a case study which has been came across. that the smartwatches that could also through this mosquito repels while you're measuring the ECG can actually give you electric shock. When you are engaged with some bad habits like too many gadgets, or can measure everything from the forecast of the earthquakes and whatever you want to monitor. So believe me, the more they promise, the less they are likely to deliver. So if a watches or a device which promise to measure you too many health parameters, be aware it might promise too much, because it would be fantastic, but unlikely that a small garage company will find you can say that holly of grade of the healthcare tracker. So there are some parameters which we have which the still the study is going on, because this healthcare is very new topic, and people are from this recent years people are getting very much engaged or focused on the healthcare data. So these ECG watches actually provide user with the heart rate and the rhythm data. While they can be useful for detecting irregular heart rhythms, or they may not have always provide a definitive diagnostic, but users should not solely rely on these devices for some medical discussions or medical concerns. So if you are receiving or concerning about the readings experience, so of course consult a professional healthcare or a doctor who have more accurate assessment. So more in terms of the privacy and security, like any connected device, these watches can connect to or can collect a lot of personal data, and also ensure that the manufacturer have robust privacy and security, because these terms and conditions are too long, and usually people don't want to read it carefully, but somewhere or somehow how they have written it that they have the rights to share your data to other applications, so that they can give you a better user experience concerning on your healthcare. So um, this is the situation which we are facing right now, and in place to protect your data from unauthorized access or some breach. um, yeah, it could be, if you will not use it, it's more better, but if you're using it, be very careful about it. Okay. So smartwatch as a strength that mostly we all look after a smooth Bluetooth connectivity, strong battery life, then fixing your calendars, your everyday activity from morning to evening. If you are doing some exercise, like if you're going to gym, then how much calories you have burned and how much you have gained. If you're running your running activity or swimming activity, so this is what exactly we look after. But what we don't look after is can you download your raw data, or you are just concerned about the display which you see on your screen, on your watches, or even your phone. um, have you tried to download the raw data about your fitness? um, are you concerned about the privacy issues, or what can go wrong? So if it is a smartwatch or any health tracker, it it will also be dependent on some sort of platform usage, like in Android or in iOS, but of course depending upon your budget as well. But also consider that lesser known brands are trend. So to give less informations, for example, you can say the use of your data, like what, since what we have discussing, that how they are going to use or how they are going to make usage of your data. Okay, so this was the about the healthcare data related to the smartwatches. Now we are moving ahead with the technology focus on the ideal hospital, or you can say the smart hospital. So, what comes in your mind when you think about the smart hospital? Like, do you try to visualize anything that how can a smart hospital look like?
So, as per my experience and awareness, as paperless, and all the reports and other things are available to the doctor and other staff at a click, right?
Mm.
And everything is so smooth. We have record available pre and post, and wherever the history is, the health history is available to the doctors. And surgeries and other cases are now done by robotic help, and remotely also. All the doctors who are required to assist in the surgery or a case, they can connect remotely or video
Mm-hmm.
conferencing, other kind of remote presence, and they can
Right.
assist surgery at real time basis. Yeah,
Right.
that's my awareness. You can add
Yeah.
on as
Yeah. Exactly. Exactly. This is what is going to be the future. So, like high tech, big machines, physician analysis, and the um, the obtained data from patient's device, big LED screen for greetings or for visitors, especially after this the COVID, which has hit the whole world, and some facial recognition, some patients visit, or you can say the robots leading some sort of operations where there will be very less human interactions. So, but somehow in this world, like kind of hospitals have already been in concern or being implemented already, and so which one is focusing more on the you can say the patient facilities, and how they are concerns about from the diagnostics, from identifying the patient illness to giving all the diagnosis to the patient, and how they can try to cure them without interacting with the human or with no human touch. Okay, so NFS is like same way, need for speed. So it's the same here in the hospital, that we are uh, involving more in terms of technology. That of course we need a lot of speed for hospital, with the integration of AI into everyday, from cameras to microphone to monitoring all the patient's activity. So ongoing to the full 360 on hospitals. They decided to give full insights into how hospitals will be in the coming years, or how it can be looking like. So, as you will see, that it won't take a leap or a science fiction. Instead, these are logical, or you can say unambitious steps, which are leading for a better patient experience, lowering healthcare cost, or save the data handling. We often already see some elements that following this all this practice, but not all in one situation. So the AI going to be a very game changer, especially the generative AI in healthcare. Already the robotics, and you must have been hearing a lot on the internet that the robotical surgeries are being implemented, and they're actually replacing the job of these doctors, and they can even do a better surgery than them. But are they going to be reliable, or even the safer than it should be? Because uh, they don't understand the power of you can say the how much pressure, or how much power it should be given for any kind of surgery. Okay, so the things which ideal hospital, or we can say a smart hospital, is going to be, it's going to be completely paperless. Starting from, if you have visited a doctor in a hospital, um, the prescription which like say that your hospital, your doctor is sitting on the seventh floor, and he's writing some prescription online, and it will be sent immediately to the pharmaceutical, which is sitting on the downstairs. And till the time you will go downstairs, you will have your medicines, or these prescriptions written on your table. You can just carry it on and leave it right away, and the bills which has been generated can definitely be uh, you know consumed, or will be given immediately on your mobile phone. So this is
Yeah.
how.
So, yeah, and I'm sorry, we have a
Yeah.
question. It's like, is there any law guidelines, or is only depending upon the quality of the hospital regarding the remote consulting? I myself have observed during Corona and afterwards as well. Sometimes doctor is referring the papers or the reports of the old reports in a very quick manner and giving the prescription, or not at all. They're checking that sometimes connection is not working and we have paid in advance. So this
Mm.
depends upon is there a law behind, or is it only depending upon the quality of the hospital they are maintaining, or we have consumer right as well as a the normal consumer forum, or there's a specific forums which can be reached for any concern with the hospital issues or these kind of equipment if those are malfunctioning and provided by healthcare companies either or by the hospital itself.
Mm-hmm.
So, yeah.
Yeah. So for any law in terms of hospital, I'm not sure about it. But yes, HIPAA compliance, if we will talk about the compliance perspective, there is like HIPAA have HIPAA compliance only tell that if you're implementing any smart hospital, so throughout the data transfer, so there's one famous protocol in the healthcare industry, which is known as DICOM. So which is actually helpful for transferring data intranet or over the internet. So HIPAA says that whatever data is being transmitted internally or even over the internet need to be, there are some rules and privacy issues, or we can say rules and privacy concerns which should be taken care. That
Okay.
that's
So
why
those
we.
are based on what data protection and privacy,
Yeah.
right? But what
Yeah.
about services? Means if we have any laws which are covering, or those are normal consumer laws which are covering, or not any specific laws for these cases?
I'm not sure about any
Okay.
specific laws,
Okay.
but you can say that if any specific device you are targeting of for sharing and exchange of data, you need to follow the FDA guidelines and the US FDA, you know, you can say the US FDA rules before making it launch in the market, or before making it used for any patient data or privacy. So if you won't pass it, you're not allowed to use or transmit the data over the internet.
Neelam, another question we have received from the member,
Mm-hmm.
the chapter member, that like HIPAA is a law which is applicable in US, right? And which is particularly on the data and other compliances, particularly on insurance portability as well. But do we have something comparable in India also, or we are government is planning something, if you're aware?
Yeah, so like I have a few customers in India. When I asked the same question to them, so they said for India, FDA or even HIPAA is not so very much highlighted as of now. But yes, it's going to be in future. But if you will talk about the outside, like in China or US or Europe, they are very much concerned about the patient data and privacy. But till now in India, it's not too very serious.
In China, what is the law if they're making making, or they already have
Uh,
an?
yeah, so just like the FDA, they follow the rule, even the HIPAA guidelines. So whenever they implement a smart hospital, they have to go through all the guidelines. Like there are some standards like IEC 81001, and the safety measures of the healthcare, which is 6061, even the FDA guidelines, which take around almost maybe 6 months or 7 months to complete it throughout, including the pen test activities, um, and even the HIPAA compliance, that how they are sharing the data, how they are keeping safe, if it is not getting exposed outside the internet or to the public internet. Any more questions?
Okay, okay. I missed the name of that law, Shaina.
FDA guidelines.
Those are also applicable in China also, right?
Yes, yes, yes. But in India, if you want to sell any medical device within India, it's not strict till yet.
Yeah,
You
yeah.
can sell it without any
Yes,
medical FDA concerns.
correct, correct. Yeah. Okay.
Okay, so uh, now we were talking about the paperless, the thing, that how the smart hospital is going to be complete paperless, and the connected patient within the home environment. So that take an example that if you are sitting at home and you are alone, that you don't have anyone who can take care of you, what you will do in such situations. So it doesn't mean that you have to take some home medications which are even not being applied for you for curing out of your illness, but you can consult a doctor online or take the consultation online, and you can have a virtual talk or virtual consultations. You can even, so the services are going to be so fast that you will have everything available at your home, from starting from your meal to even from your medications, what are the improvements in your health and how much time it will take to recover from you. So these kind of facilities are going to be very soon, that the hospitals are going to cover on. Some issues related to the suppose, like some example we can take, that uh, that a patient is in a very critical situation, and it's about to die at mid of the night. But in those situation, there's no one available to take care of the patient. Even the nurses and doctors are far behind from the patient. So what, how you can conquer that? You can of course um, tape on, or you can say try to make a patient to the patient body, and when once it will, the device will notify that there are some miss patterns or some misintegrations happening inside the nerves or inside the body, and it's going to give immediate notification to the nurses, to the family members, and even the nurses, even the doctors, that this patient needs a very immediate action, and with an critical alarm sign. So this is how we are going to have a future of the hospital, or you can say a smart hospital. So now let's move on to the how AI will affect or the growth of the healthcare. So uh, let's consider three scenarios on any medical automation or medical scenarios, like a smart medical booth. So which could be referred to a telemedicine, or you can say telehealth booth. So these are nothing can be these are very small, a very private space which with technology to facilitate remote medical consultation. So patient can use them to connect with the healthcare provider or by video conferencing, and receiving some medical advice or even certain diagnostics to service without physical visit to any clinical or hospital interaction. So medical information center, more in terms of can refer as a physical or a digital information center, where include and uh, where individuals can access to a reliable medical information, brochures, some digital resources about the health condition, treatment, and how they can try to prevent such kind of things. More in terms of the medical booth in context to the COVID-19 or the COVID which we have faced, or maybe some other infection disease. This could even be a temporary testing, or you can say a screen facility to set up or to conduct some diagnostic test cases like your PCR or something like that. So consulting any patient typically refers to the healthcare practice which might seek to some advice informations or guidelines for from the healthcare professional. But um, we are just trying to, or you can say the healthcare industry is just trying to be more focused or be ready to some other virus, or you can say some other disease which can be hitting us next, like COVID. So uh, this is where we are focusing, or the future of the healthcare, why they are moving in terms of more advancement, so that we can have more sufficient or more effective uh, healthcare providing, but less death. In terms of point care center, which you can say that healthcare facilitates with medical services or to by your near location wherever you be needed. So the name itself, like point care center, says that these are designed to deliver timely or convenient healthcare services with with the goal of reducing the need of patients or how much the travel, or the if in case of large medical facilities are being required. So point of care centers, you can say that plays a very crucial role in expanding the access of healthcare or improving patient outcome, enhancing more often for the patient reliability. Okay, so have you thought about, or have you been gone about the Uber plan for the emergency, or you can say what Uber is planning for the assistant to the patient? So you can say that the Uber is morely focusing on the service which is designed for accommodating passengers for any disability or for any special need, while not focusing on the medical emergencies, but it can be used for individuals who required the assistance or medical transportations. So drivers in the plan of the Ubers, like drivers are trained to assist passengers while they are have some changes, or you can say the request for some sort of services, like suppose someone is facing from COVID-19 and till now there is no interactions which need to be required. So Uber is trying to even do the same kind of facilities, uh, depend so like reliable to the normal human budget. So for emergency services, Uber is also in some in some regions, Uber have explored for local emergency services or facilitating quicker response. For example, you can take that in some certain areas, Uber have been used for some help to transport medical professionals or for some situations like critical delivery of medical supplies, or if any in a region that hundred of people have been infected with COVID and need a very emergency assistance, so Uber can send around 10 to 20 crew members to let them help to the infected people. So this is how the healthcare is going into the shaping the future of the emergency perspective. Also, in
So,
provided.
Neelam, these services you were providing in certain geographies like US, China, or anywhere else. Means in India, may not see those.
Not in China, because in China Uber is banned.
It is not there. Yeah, yeah, correct.
Yeah. So
So in India is also not applicable, right? For now.
yeah, so like countries which have I think so in European countries, you can say that Uber is having such facilities. Even in Germany, I'm not sure, but maybe yes, in Germany. So these kind of facilities Uber have already been planned. And even if, because we know that there are a lot of stages or a lot of you can say a lot of varieties of virus in COVID-19. So taking those things in consideration, Uber is trying to involve the service also including in healthcare. So it provides actually free ride to or from the national healthcare services to facilitates for the health workers, even for helping them to commute some safety for their workplaces. So this is how the plan is going on. Okay. So how AI is being involved, we have already been talking a lot about it, but in terms of the heart imaging interruptions, AI can also automate for the interruptions for cardiac imaging or improving the efficiency, or you can say that the reading cardiac scans. So it can assist for qualifying the cardiac functions, measuring the fractions, identifying the abnormality through the ultrasound, and for personalized treatment plans. So AI driven algorithms can analyze patient data to create personalized treatments, including the medications, the lifestyle, and how they can lead more effective treatment, if improvement in patient, which can lead to a good outcome. So AI in terms of the remote monitoring, you can say that the device can continuously monitor the patient heart rate, activities, and the levels, which provide real-time data to both patient and healthcare providers. So remotely monitoring can help or detect changes in the patient condition. It can be done early, before getting diagnosed, or you can say before having a severe attack, or can enable the timely interventions. So so AI is going to be so much involved in healthcare that before you come to know that you are going to hit some serious disease in future, you can try to overcome at a very early stage. So this is how the healthcare is providing us services to the consumers. But how about the like we are focusing more on the the data and privacy of the consumers, how we can focus, uh, or how we can try to be more reliable. Because when we say that if there is some technology or some device getting involved in any human body, we obviously get scared because we need human interaction to tell that what we are facing right now, what situation we are going through, and how they can help us. Like communication is more feasible or more frequent than getting involved into technology. So this is how mostly the people prefer to do. Are these AI or the technologies are going to be helpful for us? This is still question mark, and people are not getting the research is still going on that is it completely going to leave or can completely replace a human, or how the future is going to be.
Yeah, rightly pointed out, Neelam. I believe this may not be completely remove the requirement of a human, but it will surely help a remote, feasibility of a doctor's availability and consultation, particularly for the elderly and remote people, and it will enhance the doctor's efficiency and patients' requirements to help each other with respect to maintain a history and maintain a quick diagnosis, right?
Mm.
So
Right.
I believe in India also lots of startups are working in this area, like facilities of ambulances through AI and ML software applicabilities and other other equipments which can help remote patients to get a quick help and diagnosis remotely also. So
Right.
very interesting and good topic, and are the need with respect to country like India, where a lot of the people were working in a small
Mhm.
locations, villages, or cities.
So this is all for today. If you can have any questions, you can ask me, or you can ping me on LinkedIn if you have questions ahead. No problem. I'll be happy to answer all of you. Um,
So, Neelam, as we have seen in the profile that you have worked on some vulnerabilities also. So these are the CVIDs which you have yourself researched or you have contributed, or how it is.
yeah,
Uh,
yeah, I have researched by myself.
okay. So if you want to talk about those a little bit about what kind of vulnerabilities those were.
Yeah, yeah. So for CVIDs, which I has been registered on my name. So the first four CVIDs are like on the patient blood pressure monitor. So which was a smart BP machine, and it used to communicate through the Bluetooth, and you can actually operate it through some not even touching the device. You can operate it from your laptop, and you can send the commands, or over the air you can let them do whatever actions you want to perform in it. um, the other two are for the but these are more focusing on the electric sorry, the automotive, like you can say that in it is how you say smart vehicle, or you can say electric vehicle. Yeah. So that there was a vulnerability on the key fob. You can, if you want to unlock the vehicle remotely, or just by capturing the RF signal, you can analyzing the patterns, and you can try to unlock from your end the vehicle, and you're ready to drive. Okay. So this is all from me.
Sure, sure. So I believe thanks for the session, Neelam, and I believe you have touched few points which are really pertinent in today's world, and how AI and other software technologies are helping the healthcare world, and what are the threats and worries. So, as per some queries for the members, I would like to explain that these are the individual thoughts of
Mm-hmm.
our speaker, and as initiated in the initial conversation only, she expressed that she is not covering anything for the brand or other type of technological devices or the inventions, but we just need to be careful about the data concerns and the readings, also the output also which we are receiving, and we should not rely and we should double check with actual doctor's help. So this was the only uh, disclaimer which I want to give. Other than that, we are conducting a workshop on 30th. This is a physical workshop which is going to happen on Data Protection Act of India, and this will be in Metro Hotel, Delhi, on 30th September. So, guys, this is absolutely free for the members. So, you should all come. Please make the word, spread the awareness among the members that they should join this workshop, and we will share the link also. The registration link is already shared on the LinkedIn web page, Engage portal, and on the WhatsApp of the few members who have given their numbers. Others who have not provided their phone numbers to us, please reach out to Insha, and you can send us mail also. Provide your phone number so that we can reach out to you efficiently. In the link also that I have handy LinkedIn post. You can register on these, and you can find the post and you should register. Any more query on this workshop? I can see in the Q&A section I can address. Fine, Ashish. Thanks. So I encourage all the members and I urge request that this is going to be very good workshop on 30th with in a joint collaboration with Tuksud. Please join. And if you want to contribute in that also with your expertise, we will give you a forum on 30th. For some time we can book our members also who are who have expertise and skills in this area of data protection, and they can talk about that. So, any more query for today's workshop, today's webinar in the Q&A, please? We have, for now, there is no query, Neelam, but I
Yeah.
believe uh, very good points we have covered, and there are more research and focus is required. I believe there is some guidelines uh, in pipeline, and some are released also for Indian digital
Mm.
healthcare world called Disha. Maybe I couldn't find something relevant, something specific from the government side. But yes, there are some guidelines. Some members also have indicated there are some guidelines released uh, or in pipeline which are in focus for digital healthcare world.
Sorry.
I'm saying there are some guidelines released or prepared by the government for Indian healthcare digital
Mm-hmm.
world also. So
As of
that,
now, we are following more on the HIPAA compliance. But if there are any specific, I'm not sure about it.
yeah. So see, HIPAA compliance is kind of two flavors. One that we when we are serving US companies or customers, then we have a liability to follow that compliance, and another case is best practices. So that high trust give us controls with our best practices against HIPAA compliance. So
Mm.
in India, however, there is need to have those kinds of regulations act so that the practice can be regulated. However, we have started, I believe, Indian government already released Data Protection Act, and this will go a lot, far with other facilities, services, and areas. So I believe good session. Thanks, Neelam, for joining,
Thank
and
you.
be our speaker uh,
Thank
on
you.
Sunday.
Thank you for
And
your time.
thanks, Neelam. Thanks all the members. Do give us your feedbacks in the link you will be receiving and suggestions. And please join us on the workshop on 30th. We are doing a lot of efforts to make it knowledgeable, fruitful, relevant for the members. And we are preparing for the workshop also. so that it will be useful and fruitful for you. So, as I said, if you want to talk on the workshop day, as per your expertise, you want to present something, you can connect with me and Manisha and send out a mail also, so that we will spare some time. We will see that the topic which will be relevant. We can book a slot of 30 minutes on the same day. Thank you, everyone. Thanks.
Bye bye.
Bye bye.